for many years I worked in the chemical industry. Back in the 1970s, we were handling heavy materials in large oil drums, and you're talking about a weight of about 450 to 550 pounds in a drum. The only way to move individual drums was to break one onto its edge and roll it. And a lot of people that I knew back then, if the drum started to fall, instinctively they'd grab for the drum. And many people had lower back injuries and shoulder injuries caused by that automatic instinctive response to reach for a weight. Many of my friends have had back surgeries, and I don't know anybody who's been happy with the back surgery. Several of my friends have had shoulder replacements, and again, I don't know anybody who's been happy with the result at the end of the day. Sometimes these surgeries get rid of the pain, but it's very, very difficult to replace a shoulder. It's a very complicated joint. Anything that you can do to defer or delay or just not have a shoulder replacement operation done in the first place is a really good move. So if you can do a process with Dr. Fu and get your shoulder fixed like I did, it saves you a lot of pain and discomfort. I have a very good friend who had a shoulder replacement several years ago. The replacement's so difficult, he got a bone infection that was treated for about a year with antibiotics intravenously. They couldn't get rid of the infection. Finally, he had to have a second shoulder replacement, and that fortunately has worked out for him, and he's in good shape now. But he could no longer do his physical job at work that he used to. He's now retired. But if you get injured before you start messing around, having people cut on you, explore other possibilities. Thank you.
Yes, that's why I like you talk this story. I really be touched. I think the people before they go surgery or something seriously, you better try with the traditional acupuncture or Chinese medicine, special Chinese, they have experience from natural many years. Try that. That's always benefit you, and you don't lose too much too.
Yeah, and at the end of the day, if acupuncture or traditional Chinese methods are always worth looking at, because what have you got to lose in many cases? If the Chinese medication and methodology doesn't work, most of the time, even if it doesn't fix the problem completely, it will at least help, and probably if you do end up having the surgery after all, it will also almost inevitably assist you to heal afterwards.
Yes, thank you.